All right, how's it going, everybody? This is Omar Thabit from MotivateMe313. I am behind the camera, and I am live here today with Dr. Patterson. First of all, Dr. David Patterson, by the way, thank you for doing this interview with us today. I really do appreciate it. And again, thank you for all the things that you have done for us, especially for me over the last couple years. But people don't come live to hear me talk. They want to hear the guest talk. So Dr. Patterson, can you please first of all tell us about yourself?
Sure. My name is David Patterson. I'm an orthopedic surgeon at the University of Michigan. I'm originally from California. I grew up there. My dad's a salesman. My mom stayed at home. And I knew from an early age that I wanted to kind of get into medicine. I was interested in biology and lots of different things. I went to college at UC Berkeley, kind of opened my eyes being in a big place, seeing all sorts of life options, but really decided that I was interested in research and medicine, so I went to medical school in Los Angeles and really fell in love with anatomy. I thought the human body was incredible, especially how the different parts worked. Especially things like muscles and joints. They all made sense to me, unlike the spleen. I mean, the spleen is important, I'm sure, but I didn't really know what it did. Where all the muscles and tendons made sense to me. So I went off and did orthopedic surgery training in Seattle and fell in love with sports medicine because those patients tended to be the young, active patients where something took them down a few notches and it mentally bothered them so much. But we had the ability to often get them back to a good level of activity. I spent a year training at the University of Iowa as one of the team doctors there, learned from the team doctors, and got to be up close and personal with a lot of athletes over time. And then stayed in the Midwest and joined actually at the Detroit Medical Center originally, being one of their sports medicine specialists and team doctors. And then was blessed a year ago to have the opportunity to join the University of Michigan, where an even bigger part of my role is teaching. I get to teach other trainees and fellows, and a greater percentage of my time can be devoted to research and trying to really advance the field of orthopedics and sports medicine.
Thank you for mentioning that, because that is my next question. Segue to the next question is, so how did you become an assistant professor for orthopedic surgery at University of Michigan, and what is it like? So I guess first answer, how did you become that, and then tell us what is that like?
Sure. So at the Detroit Medical Center, we did have residents and fellows, and it was a teaching program as well. And one of the things that I missed was some extra dedicated time to do research. And they didn't have quite as many resources as the university. The university is huge and so many departments, and so there was a lot more opportunity available here. My counterparts at the university had heard that about me, and so they called me and asked if I would be willing to join them, and it was the right move for me. So it's really sad to leave my patients and the people that I work with, but it was something that I found to be more fulfilling. So right now what that means for me is that while I still see patients in the office a couple days a week, and I'm still doing surgery a couple of days a week, that I have more time to have research meetings, to take people aside, to teach them, to give talks, to work on some of these things, to go out into the community, to go all over the state and sometimes all over the country to teach. And that's something that is the university likes because it helps get the name out there, but that's also part of their mission to a greater extent. And so my time is still, part of it is clinical practice and seeing patients and doing surgery, but more of it gets to be teaching and doing research as well.
And you enjoy doing that part, the teaching part, assuming that you...
Absolutely. Even though treating each individual patient is a blessing, and that's the reason why I went into medicine and orthopedics. Also being able to kind of leave an imprint on the next generation. And I'll be honest that like all surgeons do have an ego, and what I think is important, I want to make sure that the people coming up behind me know what I think is the right way to do it, and to try to hopefully impart some of that wisdom.
Thank you for sharing that. So one of your specialties, if I am correct, as an orthopedic surgeon, is the leg. So as you know, well, this is me just coming up with this on top of my head, but there's probably statistics behind this. Is in the last 20 years or so, there has been more soft tissue injuries than in the past, especially ACL tears. Why do you believe that this is the case?
Yeah, so I think there's two main reasons for it. The first is that we're honestly better at diagnosing them than we used to be. It used to be back in the day that people would have these injuries and that they just kind of wouldn't totally trust their knee, and this is what your grandparents or your aunt or uncle might call their trick knee. Maybe they're not playing basketball with you, they're going on, they're living their life, but they don't trust their knee enough and it does some funny things. Now with things like MRIs, better physical exams, and honestly better teachers that taught me, we're better at finding those in patients and being able to help them. But the second part of it is actually that is more specific to what you're saying. Why are we seeing more of these injuries? And that is that there is definitely a trend in the last 20 years for what we call single sport specialization, where somebody at a young age might show some promise in a single sport like soccer, or gymnastics, and then their family thinks, oh man, like my kid, they're going to be so great at this, and that they start to invest so heavily in that one sport that is all they're doing all the time. And it's actually good to get out there and do multiple sports. It's good for the body. Cross training is really important. And if all you do is one thing all the time, over and over and over, it does set you up for injury. So we tell young people all the time that it's important to get out and do multiple things, other sports that you might enjoy, and don't get locked into too much of one specific thing. Because if you do, that actually does increase your risk of injury. ACL is one big part of that.
Thank you for mentioning that. That's definitely something, a lot of the viewers are athletes, or they believe that they sticking to one sport is the best option.
Yeah, that's actually, back in the day when this started to be a thing, we weren't so sure. And now we realize it's actually a very unhealthy thing. So if you look at a lot of star athletes, part of it is they were genetically blessed, but part of it is that they did cross-train. They did multiple different sports. There's a couple of exceptions that we know that it's tough to get into later. Ice skating is one, gymnastics is another, but a lot of the world's best athletes didn't pick up their sport until high school and sometimes even later.
Thank you for mentioning that. And so, you always mention to me, like when you and I talk to each other, even myself, I'm coming from about 55 minutes away. So that, you have patients who drive a long way to come see you, Dr. Patterson. That speaks a lot about the doctor that you are. I could sit here and rant about how great of a person that you are, but I want to hear, why do you feel people come out their way to see you, specifically you?
So I think it's because I try to understand why the patient is here and not just rely on any single test. Like, patients are more than an MRI to me, they're more than an X-ray. And somebody is here because something's not right. And I try to go out of my way to understand what can I do to really help that person. Oftentimes, I try to do the first question that I ask when I walk in the room is like, how can I help you? And it sounds simple, but I really want to try to relate to why that person's here. And I think that patients respect that. They don't just see themselves as like a lab test or an MRI or an X-ray, but they understand that I see them as a human being with specific goals and concerns and fears and anxiety, and hopefully I can give them information that is most relevant to them, and I think that patients respect that.
I definitely agree to that as well, so I definitely understand where you're coming from. So as an orthopedic surgeon, what's the most important thing to you when it comes with dealing with your patients?
Yeah, so I think that probably it is putting yourself in their shoes. And honestly, you can't put yourself in their shoes if all you're doing is looking at their MRI or their X-rays. You got to understand what their motivation is. What are their goals? I always ask people who they live with. I want to know who's going to be around to help them out, who might be available to, help them get them to therapy or rehab, which is also a critical part of what we do. And I want to understand the dynamic of their work, their goals. So I try to put myself in their shoes. That is the most important thing I can do. anybody can go to class, go to school, and try and learn the different problems and the correct treatments for them. But one of the things that's special about sports medicine is that not everybody is the same. Everybody has different goals and aspirations. And so I have to take a few minutes every time I'm meeting with a patient and put myself in their shoes. That is, to me, that's the key to having a successful relationship with that patient.
Thank you for sharing that information. And you definitely do that, like I said, speaking from my own experience. So the questions I usually ask the guests, similar questions are, tell us about yourself. And this is a MotivateMe313 page. So I asked the guests, like, what gets you up every morning? What is your motivational factor?
So to me, the thing that gets me up in the morning is that I'm blessed to have two roles in what I do. And I kind of alluded to this earlier. The first is that I get to touch a lot of specific lives along the way in very tangible ways. And that might be talking to somebody in the office. It might be doing their surgery. It might be checking on their knee 3 months later. So I have all these very specific, tangible things, but I also have kind of this big, long-term part where I do get to impart knowledge. I get to be part of the research teams that's hopefully contributing to the breakthroughs that mean that I'm doing things very differently at the end of my career. So the things that get me up out of bed in the morning are the fact that I know I'm going to touch 20, 30 lives that day, but also that I will have this ability to contribute to my field 20, 30 years from now. And if I just stay in bed, that's not going to happen.
Yeah, definitely, I agree to that. And then the final question is, for someone who may be walking in the same or similar footsteps as you, what advice would you give them? Motivate me.
I'm not going to lie, there's a lot of hard work, and that talent is important, but if you don't put in the time and the effort, hard work will take you a lot of places, and that might mean late nights, early mornings, weekends, sacrifice, but nothing comes easy. Nothing worth having comes easy. And I tell my patients a lot of the times that the work you put into it, you will get out, and that's what you get out of life. If you put the work into life, you will prosper. And it may not be right away, it may not be in 6 months from now, it may not be a year from now, but you put in the work, it will pay off. I think that, and then the second part of it, kind of alluded to it before, put yourself in another person's shoes, and you'll respect that person more, and it will change your interactions with them. You'll learn more about other cultures, you'll learn more about other people, and you'll be a better person for it.
All right. Any final words you want to say out there for people that may be watching? I mean, I know we're in the middle of a pandemic, and a lot of things going on in the world. So I guess this is your time to, if you want anything you want to say or anything you want to add.
Sure. I'll just kind of to what you're saying. These are strange times, but you know what we can do? We can just try to be as smart as possible. Nobody likes the way that things are right now. But if you respect the medical process, respect the medical field, we'll get through it and get to a more normal time sooner. And trying to fight it, I understand everybody that we're blessed to live in a free society and free culture, but we all got to be smart and do our part. And that's how we get to the other side as fast as possible. So that's why we're at an appropriate distance. And we're all masked up, even though you can't see it on the other side of the camera. So be safe, be respectful. That's how we get to the other side of this as fast as possible.
There you guys go. This is Dr. Patterson, Orthopedic Surgeon at the Brighton Center of Specialty Care at University of Michigan. Also Assistant Professor of Orthopedic Surgery at University of Michigan. Thank you so much for doing this interview, Omar Thabit on the other side of the camera. This was another interview on MotivateMe313. And for those that tuned in or eventually watch this video, thank you so much for watching. Have a great day.